of use. So what comes up all the time is women very happily settled on their HRT regime and then told they can only have it for X amount of time. So could you just I know it is quite a brief answer, but could you just quite briefly talk to us about what the current thinking is around duration of use of hormone replacement therapy?
Well, very simply, we should not be putting arbitrary limits on duration of usage. It should be individualized. There should be at least an annual reevaluation of pros and cons, risks and benefits. Do we need to change the regimen? Do we need to change dosage, et cetera, et cetera? And for some women, they may never need hormone therapy. For others, may need to be on it for a whole lifetime, depending on whether those symptoms are continuing. And we know that in 5 to 10% of women, the symptoms can continue into their 70s, 80s, and even 90s.
Yeah.
Now, I've got a couple of 90-year-old women, that I've looked after in the past. So we should not withdraw it for the sake of withdrawing it. And the limits that we placed on it before were really very arbitrary, 5 years or 10 years, et cetera, which were not based on an awful lot of science. It was more to do with statistics, and when something became statistically significant, which did not necessarily mean that there was no risk before and that the risk is suddenly going to go up exponentially. Yeah. It's just that that was the time that we decided was the key point for analysis, according to the data that we had in that particular study. I think the bottom line is, I have a chat with my patients and say to them, right, are you still benefiting, do you feel, from the hormone therapy in terms of your symptoms? Are there other reasons why you might be benefiting from it in terms of your bones? Look at the cardiovascular risk, look at family history as well, of osteoporosis, cardiovascular risk, dementia, etc. And then look at risk factors such as breast cancer. Are they in a higher risk group? And then we make a balanced choice. And if they say to me, well, I feel fine, but how do I know whether it's because I'm on the HRT or whether it's because I would feel fine anyway? And that's where I say, well, there's no need to immediately come off, but if you did want to test the water, if you did want to try reducing the dose a little bit and seeing how you feel, then we can see, whether you still need it or not. So, that's the way we do it. And it's very important, actually, that we don't stop treatment abruptly, because there are some data from the a large Finnish study showing that women coming off their HRT seem to have initially an increased incidence of cardiovascular disease. So we think, although it needs to be proven, that if you come off more slowly, it's less of a shock to the system.
Right, that makes sense, doesn't it?
Yeah, absolutely. Although, as I say, that does need to be proven, that coming off more slowly, but certainly it does also lead to less rebound symptoms if you come off more slowly. But at the same time, if that person wants to continue, and they say, look, I'm still working, I'm still teaching, or I'm still doing this or that, I need to have all my faculties about me, then, right, well, this is not the right time for you to test the water.
Absolutely. And, there also should be an element, there should be patient choice involved in this, shouldn't there? This should be a conversation between clinician and their patient. It shouldn't be a straight yes or no, should it?
It's totally about patient choice. What I'm here to do, what you're here to do, is to give them the information, the facts, so that they can make an informed, evidence-based choice.
Exactly.
Ultimately.